The Podofix adhesive brace helps to quickly and effectively correct ingrown, rolled in and deformed nails. Cosmetic corrections and preventive treatments are also possible. It also serves as a suitable prevention method after successful treatment with a wire brace. The complete set includes all the products and instruments that you will need to use the Podofix brace. Braces in 3 different sizes, alcohol swabs, the adhesive, the bracing instrument, the side cutter, and the pedigel with a spatula and a microlamp. The brace is made of a very flexible plastic pad, which can be conformed to every nail form, and an integrated activation wire. The recess in the pad is used to later insert the wire. There are 4 different sizes of Podofix active adhesive brace: mini, small, medium, and large. The size should be chosen so that the brace can be adhered at least to the ingrown side of the nail, as close as possible to the edge, but that does not press on the nail crease. A smaller size brace can in general be used, which is then placed as close as possible to the affected nail side. The nail area is disinfected, but please note that the nail should not be softened before using the brace. Avoid foot baths and callus softeners before use. The nail must, before adhering the brace, have the smoothest and most flat surface possible. If required, a milling device or a soft nail file is used to smooth the nail surface or to grind it down a bit. Any loose parts of the nail are removed. Before attaching the brace, the alcohol swab is used to clean the nail. Then allow the nail to completely dry for 30 seconds. In order for the brace to lie completely on the nail surface, the fingers are used to bend it to correspond to the curvature of the nail. The brace is also cleaned with the alcohol swab and must then be dried for approximately 30 seconds. The adhesive is now applied. Wipe the brush on both sides on the bottle edge and then moisten the entire brace underside with a thin layer of adhesive. Note that if too much adhesive is used, the brace will not adhere to the nail. Position the brace in the middle or on the side of the nail that is more strongly ingrown and place it carefully on the nail. Press down on the nail with your fingers for about 15 seconds and press down the brace at its edges as far as possible toward the nail creases, so that also the central part of the brace lies on the nail. Press primarily in the edge areas of the brace while doing that. Before activation, wait 2 minutes until the adhesive has hardened. If adhering does not work the first time, the nail must be completely freed from adhesive and must then be completely cleaned. Use a new brace and ensure that a small amount of adhesive is used. Place the tension instrument into the wire loop. Turn at least once and a maximum of 2 complete turns until the desired tension is attained. You can determine the force required by asking the patient. Then press the tension instrument lightly down in order to push the wire into the recess. Use the side cutter to cut the wire loop. To do this, lay the cutter flat on the brace and cut the wire loop with a cut parallel to the loop. Now use a nail file to smooth off the wire ends. To seal the Podofix brace, use the spatula to place a drop of pedigel on and apply it into the recess of the brace. Activate the 3TO microlamp and harden the pedigel by lighting it for 20 seconds. In doing so, hold the microlamp at the smallest distance possible from the area to be sealed. During hardening, an oily layer will form on the surface of the gel, which can be easily removed using the alcohol swab. Nail edges are removed if required, and the nail crease is then plugged or treated as one would a wound, depending on the situation. The brace is removed using the side cutter at the edges. Remaining adhesive can then be removed from the nail using a file or a milling device.